Well, hello there, and good evening. Welcome to the Jimbo Hannon Show from Westwood One Radio. We're at 1-866-50-JIMBO, 1-866-505-4626. Online, you'll find us at jimbotalk.net, and you can follow me on Twitter at Jimbo Talks. Going to the hospital is pretty intimidating to begin with. You're in a strange environment. You know that people who go there don't really want to be there, and that bad things can happen there, although, of course, if you're going to the hospital, you also know that you are doing presumably whatever it is to prevent something worse from happening. So you're frightened, you're disadvantaged because of the fact that there are so many people around you who know more about what's going on than you do. In fact, that pretty much summarizes just about everybody there. So with all of this strangeness, you are there for a purpose. With professional skill and a bit of luck, you're back home quickly, and then you start getting the bills from every doctor who consulted on your case, from the hospital itself. Already you feel pretty vulnerable from the whole experience, and now you find out that you were overcharged. Recent study finds some hospitals are marking up treatments by as much as 1,000%. That is to say, if you really owed them $100, they're charging $1,000, or whatever the actual figures may be. Even the average U.S. hospital charges uninsured patients 3 times what Medicare allows. Many of the worst offenders are in Florida. A large number of them are operated by 2 Tennessee-based for-profit hospital systems, Community Health Systems and Hospital Corporation of America. We'll talk about that tonight with a return guest, Dr. James Pinckney. He operates his own private practice, DiamondPhysicians.com, based in Dallas. Good evening, Dr. Pinckney.
Good evening, Jim.
This is a pretty amazing story. I mean, you stop and think about, say, McDonald's marking up prices 10 times their previous price level. Of course, they're out of business. You know, you go to a clothing store, and the price of a new pair of pants or a jacket, that's up 10 times. Well, you walk out the door. That's the end of it. How do hospitals get away with this?
Well, you're exactly right, Jim. And the problem is, in those consumer markets that you mentioned, there's competition. And in the healthcare space, bureaucracy and managed care have eliminated almost competition completely. So hospitals can charge whatever they want. There's so much convolution. The systems are so complex. They might have 15 different charges for 15 different insurance carriers. So there's no telling what your hospital bill is going to be once you leave the facility, and that's a huge issue, and an issue that has to be solved.
Well, it certainly would seem to at some point in some way. I mean, it sounds as bad as the airlines, where I'm told there have been more than a few times in this country in which there have been flights, a whole plane load of people, all flying to the same location and more or less flying in the same conditions, maybe 2 or at the most 3 classes of passengers, and yet every single person on that plane paid a different fare to make that flight. It is bizarre in the extreme, and it seems in most cases here that if you were in a hospital, let's say, with 20 other people, and you're all in there for precisely the same procedure, it does seem that at some point that there ought to be precisely the same fees charged. Now, maybe there will be different methods of payment. Maybe I've got better insurance than you've got over there in the next bed. But nonetheless, this variation in charges, it sounds like profiteering, just frankly gouging people is what it sounds like. Are there real rationales for what's going on here?
No, it is price gouging, and you're right. Those 20 people should receive the same price for the services rendered, and I guarantee you that every person will have a different bill. And the reason, it really started in the 80s. Back in 1984, when managed care really started to come to the forefront in the healthcare delivery systems, they were charging about 1.2, 1.3 times the Medicare allowable rate. And then through the late 80s and early 90s, things started to gather momentum, and they increased. And now some hospitals are charging 1,000% markups, 12.6 times Medicare allowable rates, and the national average is 3.4 times. So that's, every $100 charge from Medicare allowable costs, the hospitals are charging $340. So where did it all go wrong? Where did it spiral out of control? And unfortunately, the culprit is managed care. These insurance providers have created a very complex system, and they've negotiated rates with each hospital, out-of-network, in-network, and there's no telling what the true cost of care is. And that's what my company, Diamond Physicians, that's what we try and do, drill down to the true cost of care and deliver excellent service at a great price.
And I want to, certainly before we're done here, we'll talk a great deal about the Diamond Physician approach to all of this. But looking at this overall problem here, I can remember when managed care came along, and I remember the rationale for managed care. Believe it or not, for those who don't know, the rationale was prices are getting out of control. We must find some method of putting a cap on this sort of thing. How did the method of protecting us from high prices become the method of gouging us with high prices?
Well, the hospital margins started increasing, insurance brokers and premiums started increasing, and now all of a sudden capitalism took control in a bad way. And now the American people are paying out of pocket for things that used to be covered by insurance in an appropriate manner. So the problem is hospitals aren't practicing fiscal responsibility. If they want to charge 2 or 3 times what Medicare allows, I think that's okay, but it has to be consistent across the board. You can't charge one individual $10,000 for, let's say, a heart catheterization, which is the most profitable procedure in all hospitals, and then charge another person whose insurance happens to be out of network, and they probably didn't even know that, $70,000 for the same procedure.
Well, obviously you can. I mean, you can be argued that you shouldn't, but I guess obviously you can get away with it. Now, I guess part of the problem here would be the transparency of it all. If I, for example, do in fact go to the local men's clothing store, and if enough of us show up there and we're buying slacks, and sooner or later people will start talking, hey, how much did your slacks cost? How much? Word would get out. It's a simple notion and easily understood. But in the case of medicine, of course, you're getting into so many different areas here of different methods of compensation, of different high-tech toys that are available today for medicine to try and apply to you. I guess part of the problem here is the lack of transparency. If somebody tries to sell me a pair of slacks at 10 times or whatever the price, I'll spot it. If somebody tries to sell me one of these modern medical procedures at 10 times, most of us just go into nod mode. Okay. I mean, because we don't know any better. And if you try to argue with your doctor, and we've had this discussion before, and I know you're supposed to be proactive with your doctor, but the fact of the matter is, anytime your doctor wants to end the conversation, all he has to do is turn on a few parts of that 4-year medical education beyond the bachelor's degree, and you're in over your head.
Yeah, and I don't think that the fault lies in the hands of the physician. The problem is when you walk into a hospital, you have no idea what those costs are. So if the hospital displayed their fees in the reception area, how much is that heart cath going to cost? Then you could actually shop the market just like we do retail stores, and you would go to hospitals who offered more competitive prices, and that's where the problem lies. You're right on the button when you say there's no price transparency in healthcare, and they want it that way. They want the system to be extremely complex and convoluted, because if you saw a hospital charge $70,000 for a heart cath, and then right down the street a hospital still had the same outcomes, charge $10,000, where would you go?
Well, as a general rule, now this is something else that comes into play here. If I'm just buying a pair of pants, well, I'm not certainly one of these clothing snobs who would automatically gravitate to the 10 times as expensive a pair just so I can brag about the cost of my clothing. I'm the kind of guy who's just going to buy the cheaper pair unless they're ugly or they don't fit or they fall apart. That's what I'm going to do. But with medicine, you're in a whole different area here. Now, I think most of us confused and not that well educated about the modern medical miracles, techniques, and the like, are prone to say, well, it's for my health, it's for keeping me alive. I don't know. Maybe I'm getting my money's worth. Maybe the procedure that costs 10 times as much elevates my chances of staying alive. There's so much more on the line here than there is if you're just buying a pair of pants.
That's true, but all hospitals are responsible for outcome measurement. So if we made this data more available to consumers, then you could actually go online and maybe look, hey, I'm shopping for a certain procedure that I need. Let's say I need a gastric bypass, and Hospital A offers gastric bypass, and they have a 2% complication rate, and they charge $20,000. And Hospital B has a 3% complication rate, so pretty similar, but they charge $85,000. That's where we can start making conscious decisions and start shopping the market and start introducing competition, which will ultimately lower healthcare costs.
Which I'm all for, and we'll come back and talk some more about that as well in just a moment. But if there are all these different deals worked out, different insurance companies have worked out different deals with different hospitals or different chains of medical care and the like, how do I really know that in fact I'm able to compare here? In other words, I'm comparing apples and apples, not apples and oranges. I mean, it's still tough to know because, of course, quality means a lot to most people, unless you are just dirt poor and there's just no way that you can cover the cost of something. Most of us are going to say, well, I can skimp on the pants. We can get a used car, but for my family's health, I'll pay the freight. That's the mentality here that they're counting on, isn't it?
Some consumers do have that mentality, and that's okay, but you still have to do your due diligence. So if you want the best of the best, you want to know exactly what your insurance policies offer, know your hospitals that are local, surrounding you, so that if you have an emergency, you can make a conscious decision where to go to receive the best care and not be in one of these price gouging situations where you get a $100,000 bill for something that should have cost $15,000.
Sounds good to me. We'll come back and talk some more. Again, our guest is physician Dr. James Pinckney. He owns his own private practice, diamondphysicians.com. They're based in Dallas. He is a physician at Methodist Hospital for Surgery in Addison, Texas, and the Baylor Uptown Medical Center. And we're at 1-866-50-JIMBO, 1-866-505-4626. Hope that you're feeling well. Take a break and join us back in just a moment. Thank you for being with us on the Jimbo Hannon Show at 1-866-50-JIMBO, 1-866-505-4626. Hospitals marking up prices as much as 10 times. That is really outrageous. We're talking about that with a man who says he's found some ways around this. He is Dr. James Pinckney, operator of his own private practice, diamondphysicians.com. They're based in the Dallas area. To what extent can any of these price increases be attributed to the fact that there are a lot of very expensive new high-tech techniques and devices available which can help save your life? And that's wonderful. I'm happy for that. I'm happy that there are MRIs and CAT scans and who knows what all else out there that can keep me alive. But I'm wondering the extent to which hospitals have been unable to recoup the cost of using these things and have to hit us elsewhere to make up the difference. I'm just, I guess, sort of groping for rational reasons why this is happening. Is any of this related to the high cost of modern medicine?
Slightly. I think one of the drivers could be technology. When we introduce new devices, they are expensive at first until a few years later when those technologies do decrease in price. But hospitals don't implement those technologies unless they think they can generate revenue. And a strong profit margin. So I think other drivers are consumer demand is a big one. Healthcare in this country, we don't focus on prevention as much as we should. We spend about 85% of healthcare dollars on chronic diseases. So a lot more people have the 5 major chronic diseases, and that's driving the cost of healthcare up. Fraud and abuse. There's all kinds of Medicare fraud and insurance fraud out there right now. We've got litigation and risk management. Lawyers, they love to put together these class action lawsuits and sue hospitals, physicians, pharmaceutical companies. That's a rising cost. We've got government mandates and regulations. The more bureaucracy we have, the higher the cost. You have to jump through all these hoops. So that's a huge healthcare cost driver. And then again, yeah, I agree. The cost of technology, providers, the RNs, staff, all these costs are going up. And then, of course, just inflation.
What about the cost generated by people who use the emergency room as their primary medical practitioner, if you will, their main source of medicine, which was never the purpose, of course, of the emergency room? Has that been a cost that could have driven up costs elsewhere, so that we're subsidizing the deadbeats?
Oh, exponentially, Jim. That's a huge one. I still do ER shifts, and I'd say 98% of the problems that I see can be taken care of in the outpatient setting, in the primary care setting. People do not have a primary care physician, and it's very disappointing. Primary care in this country is dying. Doctors are fed up, they're exhausted, they're burnt out, they're retiring or changing professions altogether. We're down over 10,000 docs. And in the next 15 years, we'll be down 25,000, 30,000 primary care physicians. So we've got to do something to incentivize our young medical students and residents to go into primary care so that we can service individuals and they don't have to go to the ER. A lot of it is education, but also the other half is they can't get in to see their doctor.
Is it not true that in some cases medical schools, I'm not sure that the medical schools were behind this, but at least I know this has been discussed. I'll ask you if it's being done, of offering medical school graduates some forgiveness of their student debt if they will go into primary care?
Yeah, it's been implemented on a very small scale. I think we need to raise more money and offer more subsidies to students who want to go into primary care, because it's a huge problem, Jim. We do not have enough primary care doctors, and primary care is the backbone of the healthcare system. Primary care should be taking care of 60, 70, 80% of the issues, and we can. If we focus on prevention and deter diabetes before it manifests into full-blown diabetes. I have 10 years to make a diagnosis of a pre-diabetic state and start working on transforming lifestyle, diet, exercise, and reversing the insulin resistance. But it just doesn't happen because people aren't going to the doctor.
Bizarre. Well, needless to say, there are problems galore here, and we're going to come back and learn more about some of the ways around this. We'll take a look in particular at a couple of the for-profit hospital systems that have been mentioned prominently in this story. 1-866-50-JIMBO is our number, 1-866-505-4626 on the Bohannon Show. It's a complicated circumstance that we have, of course, in medicine today, and complicated all that much more by all the battles surrounding the Affordable Care Act, Obamacare. 1-866-50-JIMBO, 1-866-505-4626 with Dr. James Pinckney, the man behind DiamondPhysicians.com. Back in just a moment. Welcome back to the Jim Bohannon Show. 1-866-50-JIMBO, our number, 1-866-505-4626. As we're examining tonight the ways in which some hospitals are marking up treatments by as much as 1,000%. Now, as we have noted, a fair amount of the blame here is being placed at the feet of a couple of Tennessee-based for-profit hospital systems, Community Health Systems, and Hospital Corporation of America. Are they unfairly singled out here, Dr. James Pinckney?
You know, it's public information, so I don't think it's unfair. If they want to charge that much, then the American people need to know about it. And that's the only way we're going to get to the root of the problem, introduce that price transparency that we talked about earlier. Free market health care is the way to go. And the only way to do that is to strip away all the complexity and convoluted twists and turns that managed care has been able to set on top of our health care system.
All right. Assuming that we summon up the will to do that, we'll get into the exact mechanics of what would need to be done and where we should be headed in this particular regard. First of all, what is your idea of the ideal patient-doctor relationship here? We'll just talk about ideals for a moment.
Well, I think that's a great place to start, because no matter what we do from a political standpoint, we have to reinvigorate the patient-physician relationship. That is the key. We have to deliver access to health care, not just health insurance in this country. So I think the Affordable Care Act was flawed from the beginning. It focused on access to health insurance, which is important, but we use insurance completely wrong in today's healthcare system. Insurance should be used like your car insurance or your home insurance, Jim. When you fill up your car with gasoline, you swipe your credit card. When you need new windshield wipers, your tires rotated, an oil change, you pay cash. If you get in an accident and the damage is thousands of dollars, you file an insurance claim, and that's why your car insurance premiums are relatively inexpensive. We have to use those same systems in the medical space. So we should not use medical insurance for the routine maintenance of health. That should be paid for in a cash basis. So that patient-physician relationship, that primary care relationship, more time with your doctor, unlimited access, membership medicine is the key. That's the way to reinvigorate that patient-physician relationship. I spend 60 minutes with my clients. The national average is 8 minutes.
How can you afford to do that? Presumably, that would mean that you are roughly, making 1/7 of what another doctor is making who is spending the 8 minutes per patient.
Yes, in a fee-for-service model, but we're a membership model. So we have to get away from these volume-driven models and start looking at value. And the more value we can add, the more consumers that are going to pay for a service. And that's why we've been successful. So we charge a monthly membership fee, and we take less clients than your typical primary care physician, 3,000 to 4,000. We take about 600 per doctor, and because we're getting a monthly membership fee no matter what, we're generating revenue. So our patient-physician relationship, we're aligned. In the traditional model, patients and doctors are not aligned. If you're not sick and you don't go in to see your physician, they can't bill insurance for that claim, for that visit. So there's no incentive to keep you healthy from a financial standpoint. Our model is the exact opposite. If I'm not a great doc and I don't keep my clients healthy, then they're coming to see me every day, once, twice a week. Now my model isn't as efficient. And I'm sorry, medicine is a business. We've got to generate profit in order to keep the doors open. And our model is much more profitable. Clients love it. We spend more time with our patients. Doctors make more money. Patients are happy because they have access to their doctor 24 hours a day.
Now, if doctors are making more money and you've got a smaller patient list, then presumably you're getting more per patient. So I'm paying this membership fee, which, again, as an abstract model sounds attractive to me. But I'm wondering if I went to see you or, let's say, Dr. Jones down the block, and let's say that I'm reasonably healthy. I don't really have I don't have a lot of accidents. I don't have chronic conditions. I'm just your average person getting through life. Am I, in order for you to have, presumably, you say you're making more money, then that's got to be coming from me, right? How high is this membership fee?
Not necessarily, because we're more efficient. So we've cut costs on so many different avenues in our model. Our fees start at $45 a month for kids. Adults are $95, and on average, it's about $145 a month, the cost of a cup of latte a day. So people go to Starbucks and these coffee shops and spend $3 or $4 a day. If you can just take that revenue and move it over to your health, you've got yourself a concierge doctor in our model. So it's not that expensive.
I've been hearing about this term, the concierge doctor. It certainly sounds like something that every patient would want once it was explained to them. It certainly sounds like something every doctor would want. Who is it who doesn't want this? It has to be somebody.
Oh, yeah. Hospitals, managed care, people that are making a lot of money off the current system. Blue Cross, Blue Shield, Aetna, Humana, Cigna, and United, all of their stocks are up over 100% in the last 5 years. I think Aetna had a $653 million quarter last year, one of their best ever. So there's some big companies making a lot of money off healthcare, and they're not going to be happy about little guys like me introducing price transparency and completely changing the model. But we have to. We're spending 17% of our GDP, Jim, on healthcare, more than any other industrialized nation. Our debt is going through the roof. We spend $2.7 trillion a year on healthcare, and about $800 billion of that is completely wasteful. We've got to change, or our country will go bankrupt.
No argument there. Now, if a doctor, let's say a doctor listening to this program, who maybe has heard the term concierge care and has not really paid that much attention to it, if he decided to go into this, I don't suppose there's anything that the Aetnas of the world can do to prevent him from doing so, him or her, right? I mean, so presumably, if it's such a good deal for all concerned, then doctors and patients could just walk away, and you could leave the Aetnas and others of the world with stock certificates that are useful primarily for wallpaper.
Absolutely. We still have that free choice. So it's just a matter of educating the American consumer and let them know that, hey, you can shop healthcare costs. And that's what Diamond Physicians and other practices like us, that's what we do. We're medical services wholesalers. So I've gone out and I've shopped the market for the lowest price for a cholesterol check. So I charge my clients $4 for a lipid panel instead of $126 at most of these big lab companies. I charge them $400 for an MRI instead of $4,000. $60 for an X-ray instead of $500, and so on and so forth. That's what we're going to have to do to lower healthcare costs globally.
And everybody goes along with this. For example, when you say you shop, I would think that if in fact for these particular procedures, these results, lab results, if you will, I would think everybody, regardless of whether you're in managed care or concierge care, everybody would shop for the cheapest type of these procedures that are reliable and the like, just to maximize profits, because that's one thing you and the managed care people have in common. You want to maximize profit. So why doesn't everybody go to these cheaper places to get the $400 MRI instead of the $4,000, and why don't the people charging the huge amounts go out of business?
Because there's no price transparency. And I had to search wide and far to find people that would even negotiate with me. And that's the issue. The big firms, they don't negotiate because they don't need to. Their network is so large they can charge whatever they want. But when the little guys start creeping up and start offering reasonable prices and sometimes stellar pricing, then they can find traction. So we've gone out and contracted with smaller third-party vendors, lab companies, imaging companies, who, offer reasonable rates. They practice fiscal responsibility. Say, hey, you know what? My cost is $200. I'll still charge $400 and have 100% markup. But, $4,000 for an MRI is just absolutely ridiculous.
It certainly would seem to be in this context. All right, more to come. 1-866-50-JIMBO. James Pinckney, the man behind DiamondPhysicians.com. Back in a moment. Welcome back to the Jim Bohannon Show. We are talking about the cost of health care and doing so in information that may be somewhat disturbing. Our guest is Dr. James Pinckney. He operates DiamondPhysicians.com, a concierge-style private medical practice. I want to read to you a news story that you may or may not have heard about, but it certainly affects this discussion. Aetna is reported near an agreement to buy smaller rival Humana for about $34 billion. It could be the first in a series of mergers among the country's big health insurers. Aetna would pay about $230 a share, 29% higher than what Humana shares have been trading at. The deal could be imminent, although the formal agreement has yet to be signed, according to these reports. Many of the country's big health insurers have been rushing toward a new round of consolidation, seeking to gain greater scale and wring out costs from their operations. Such belt-tightening is increasingly important because many of the new customers that insurers are seeking are more sensitive to the price of health coverage. At the same time, getting bigger would give insurers more clout to negotiate prices with health systems. This push received a jump start this past week after the Supreme Court upheld the key portion of Obamacare by ruling that the federal government should continue to subsidize health insurance for lower-income Americans. The court essentially guaranteed huge new markets for insurers. Many of the new customers would be coming in through Medicare, a particular strength for Humana, and one of the main attractions for a bevy of suitors, which also included Cigna and Anthem as well. Your thoughts about this story, Dr. Pinckney?
Well, Jim, the government has promised $2 trillion over the next decade to the five major payers in the form of insurance subsidies. That's $200 billion a year. So if Aetna consolidates and buys Humana, that is not going to be great for the American consumer. When you have a large company that merges with another company, you have less competition, and therefore insurance premiums will continue to go up even more. We've got to use medical insurance in the proper way. I used the car insurance analogy previously. Medical insurance should be used for catastrophic coverage only. If you have a motor vehicle accident, you need a surgery, you have a heart attack, that's when you should use medical insurance. Anything below your $5,000 deductible should be paid for out of pocket, and that's the only way we're going to lower costs in this country.
Is this an answer for the indigent?
Absolutely. You know, we have a lot of clients that don't have any insurance at all, and they scrape together $95 a month to see us, and they receive the same care that our exceedingly wealthy clients receive. So Diamond Physicians, the direct medicine model, is for everyone. It's a beautiful model. It doesn't discriminate. It doesn't matter how much money you make. Our prices are affordable, and our labs, imaging, and ancillary services pricing is the best in the country. You won't find a better rate.
Wow. That's it almost seems too good to be true. You'll forgive me, but I'm also thinking I'm missing something here. What am I missing?
We just use common sense. We cut out the middleman, we cut out all the fluff, and we deliver an outstanding product at an outstanding price. It's very simple. We went back to the basics, to the 50s and 60s, when the patient-physician relationship was the most important thing in medicine. One monthly membership fee, just like a gym membership, unlimited visits, 24-hour access to your doc, no copay. All your acute medications and procedures are included, so we throw in unlimited urgent care, so no more ER visits unless you need to be admitted. And that's what the ER is for, true emergencies. You come up to our office, doesn't matter if it's 11 o'clock on a Thursday night. You have a laceration, we stitch you up, we have you home within an hour. It's a beautiful system, and if it catches on, I think it will. We've had exponential growth not only at Diamond but across the country with the direct primary care movement. This will be the future of healthcare in America.
Wow. Think about it, folks. We'll come back and talk some more in just a moment. Welcome back to Jim Bohannon Show. We're learning a bit about tonight about price gouging in the healthcare industry and something called concierge-style private medical practice. Our guest is a practitioner of same, Dr. James Pinckney with DiamondPhysicians.com, based in Dallas. Lynn is in Medford, Oregon. Hello, Lynn.
Hi, how are you?
Fine, thank you.
I appreciate the information. It sounds like a wonderful thing. I know this affordable health care doesn't appear to be turning out very affordable for everybody. And it seems like we have still thousands and thousands of people with no insurance. They're just different people. So to me, I think we lost the opportunity to revamp health care because, in my opinion, they should have gone after the insurance companies, and the change should have come there. And it doesn't appear to have changed any. Now, the question I have concerning what you're talking about is it seems to me that if you were going to do something like that, then what would end up happening is you would be culling patients. They'd have to apply for it, and those people that you would take would be healthy people. And then the people, now this is my assumption, kind of like being turned down for health insurance if you have a pre-existing condition. So
all right, let's get right to that and find out here, Dr. Pinckney. Do you cherry pick your patient list?
Not at all. In fact, our prices are solely based on age. there's no pre-existing conditions. So it doesn't matter if you've got 6 chronic conditions or you're perfectly healthy, you pay the same price, and we take care of you. And we have a wide range of clients, from people that I need to see twice a week to people that only come in, once a quarter.
Mm-hmm. All right. What about the differential between? Well, go ahead, Lynn. You ask your question, and then I'll do a follow-up.
Well, I'm just saying that it just seems too good to be true. I mean, it makes sense, and it maybe makes too much sense, which is why we're under the system that we're still under now.
I know. I get that a lot, Lynn, that it's too good to be true. But because our system is so fragmented and so broken, that anything that makes a little bit of sense is exaggerated because of the markups, the price gouging, the terrible customer service in healthcare. I mean, if you had a business meeting and you were 45 minutes to an hour late, you would never do business with that person again. But when you walk into a doctor's office, you wait in the reception area for at least 30 minutes. Then you go back to a cold, dark, sterile exam room. You wait for another 40 minutes. Sure. The doctor pops his or her head in for 5 minutes, and then they're gone. And you're like, what happened? So we've completely reinvented that healthcare delivery system. I spend 60 minutes with my clients on average. I greet them in the reception area myself. Sometimes I take their vitals myself, too.
Right. Now, the brief time that we have left here, and Lynn, thank you for your call, you say that you do make a differential on the membership based on age. Let's say roughly comparable health. What would be the difference in membership between a 25-year-old and a 65-year-old?
25-year-old is $95 a month, and the 65-year-old is our max price at $295 a month. And there's everything in between. Now, we are in a more affluent area, but our model can be scaled. We're the first concierge practice to franchise in the country, and it can be transformed to any socioeconomic platform. So a doctor could charge $45 a month for a 20-year-old, and $100 for a 65-year-old.
We are running out of time here, so stay on the line and we will speak off air. But again, Dr. James Pinckney, who is the man behind DiamondPhysicians.com, based in Dallas. They franchise. How about that? An interesting new wrinkle here. I'm Jim Bohannon, and this is Westwood One.